I was a healthy 11-year-old boy who played tournament soccer, hung out with friends, went to school, and hardly had a care in the world. And then one day, I wasn't.
My illness began with flu-like symptoms, extreme fatigue, and debilitating abdominal pain.
It progressed into widespread nervous system dysfunction, with a resting heart rate as high as 160, widespread pain, temporary blindness, and other severe symptoms.
I went from an athlete to a wheelchair to an hospital bed, and I missed over a year and a half of school.
Over the course of 2 years, I saw 40 doctors with 19 different specialties, but no one could explain what was happening to me.
My mom searched her memory for anything out of the ordinary just before I got sick.
The only thing we could remember was a tiny scratch from a stray kitten a week before I got sick.
No physician ever asked us about exposures to animals or insects, and I didn't know enough to even think those events could be relevant.
Had I been asked about such exposure, I would have been prudent to think more critically about them.
Eventually, I was hospitalized for immunotherapy and developed an odd rash that no one could or seemed interested in explaining.
Through my mom's research, we found our way to a physician scientist, veterinary internist, and vector-borne disease researcher who have been working together for years in a collaborative One Health approach that shares knowledge from the human and animal health worlds.
Using this approach to diagnose me, they determined that I had Bartonellosis, commonly known as cat scratch disease.
After 3.5 years of treatment, I fully regained my health and can even run again.
The One Health approach saved my life.
No one entity has all the answers to solve this complex problem of vector-borne diseases, and it requires a transdisciplinary approach to research, diagnose, treat, and prevent it.
What happened to me could happen to anyone.
In fact, research estimates that about half of all cats are naturally infected with Bartonella, and prevalence rates may be as high as 80% in feral cats and as low as 1/3 of household pets.
There is no vaccine for Bartonellosis in humans or in animals.
New research suggests that pet owners should be on the lookout for persistent symptoms following a bite or scratch from a dog or cat. They should also be on the lookout if they have been exposed to fleas, ticks, lice, or potentially biting flies.
Cat scratch disease is considered to be a self-limiting immune response in humans. However, more recent findings suggest that atypical presentations of Bartonella infection may be more common than was previously understood.
Systemic infection from Bartonella not only inhibits the immune system from mounting an appropriate response, but may also result in relapsing, non-specific symptoms that can progress to serious conditions affecting the heart, joints, eyes, and the nervous system.
What about the interconnections among human, animal, and environmental health?
I wish someone had taught me about the dangers associated with exposure to insects, animal bites and scratches, and the importance of preventing them.
Current health education standards do not address student education about One Health and One Health related topics.
Topics like playing with pets responsibly, good hygiene practices, understanding the dangers of interacting with wildlife, vector-borne disease prevention strategies, and conceptual understandings of how our individual choices can impact our environment and the spread of diseases. Yet, education is the key to preventing stories like mine.
We must do better.
Hi, I'm Jack Jessen, and this is my story about Bartonellosis and the One Health approach that saved my life. Thanks for listening.